Good morning, I'm Dr. Lou Walters at the Source Wellness Center in Bozeman. This video is going to be on COVID-19 and the coronavirus. I'm going to talk about public health as well as things you can do to keep yourself and your loved ones safe. Now, first of all, don't panic. There's been a lot of information in the news, some of it a little hyperbolic, but we want to make sure that level heads prevail. Just like in the mountains, if you get into trouble and panic, your chances of getting through it are much less. So we want to stay calm, we want to take it serious, but we don't want to lose our heads, and we want to also keep in mind the public good, not just our own individual good. So over the weekend, public health officials talked about self-isolation and spreading the curve. What spreading the curve means is we want to basically spread out the number of infected cases. If everybody gets sick all at once, what happens is the number of people going to the hospitals and seeking care overwhelms the system. There's only so much capacity, only so many beds, so much staff, so many respirators and ventilators. And that's exactly what we saw in Italy. So many people got sick so fast that the number of people going to the hospitals overwhelmed the system, and they couldn't treat everybody who needed it and had to turn people away. That could happen in the United States if we don't take precautions. So we don't want that to happen. So if we can slow down the spread of the disease so that we stay under capacity, that means everybody going to the hospital who need care can get it. And that's what we want to do. So by self-isolation, you're avoiding public spaces, bars, restaurants, meetings. If you can work from home, great, do so. Watch Netflix, do things at home instead of going out for your recreation. For kids staying home from school, we want to avoid play dates and those sort of things because, again, we're trying to slow down the spread of the infection. Now, you might be thinking, hey, I'm in a low risk group. I'm not too worried about it. I'm not going to stay home and put my life on hold. Well, we want to consider the greater population as well. People are contracting the virus and they're not showing any symptoms, and then they're going around spreading it. And we don't want to spread it to those who are at a high risk. So those would be senior citizens, elderly, especially if they have pre-existing conditions, cardiovascular disease, heart disease, high blood pressure, diabetes, and other respiratory illnesses that they had before this. The media hasn't been talking too much about it, but we're seeing a population of healthy adults, 20 to 40-year-olds, that are getting the coronavirus and developing severe respiratory damage and pneumonia and dying from this. And they're developing what's called cytokine storm. What that is a massive overreaction from their immune system. Now, there is something that can be tested in addition to just having the coronavirus if somebody is having severe respiratory symptoms from it. So the body's normal dampening or braking mechanism to the cytokine storm is called C1INH. And some people, for genetic reasons, just tend to produce smaller amounts of it. So if somebody is deficient in C1INH, they are at a higher risk of developing cytokine storm and the complications from it. So if you or somebody you care about is going to the hospital with severe respiratory symptoms from a viral infection, coronavirus or otherwise, it might be worth asking the doctor to test for C1INH. Now, as far as spreading out the curve and self-isolation, we also want to just, in general, don't get sick in the first place. So the public health officials and the media have been stressing washing your hands on a regular basis, avoiding touching your face. When you wash your hands, use soap and water, which I would imagine most people were doing anyway. I can't imagine washing your hands with something besides soap and water. They recommend 20 seconds, so counting happy birthday twice. Now that's fantastic advice. Keep doing that. Something else you can do is stay hydrated. I've talked about this in previous videos for colds and flu, but our first line of defense for our immune system is our mucous membranes, the inside of our nose, inside of our mouth, our upper respiratory tract. If we get dehydrated, we get little cracks in our mucous membranes, which is like leaving a window open for the virus to get in. So drink plenty of water. Plenty of water for healthy people would be half their body weight in ounces each day. For those with kidney issues or heart disease, it's going to be much less, and you need to talk to your doctor what a healthy amount is for you. Now, the virus seems to be affected by temperature, so I would recommend room temperature or warm water. Avoid ice water as much as you can. So the cooler temperature of the ice water can basically make it a more hospitable environment for the virus to get in. So warm water or hot water, room temperature at the very least. Now, we want to create an environment in our body that is not favorable for a virus to grow. So what you're eating can have a big impact on that. We want to avoid starches, sugars, junk food, processed foods, alcohol, juices, sodas, fried foods. All those are going to create an environment that makes it more favorable for a virus to grow. Eating more vegetables is going to help your immune system out, except I would stress not eating a ton of potatoes due to the starch in them. Especially broccoli, eating more broccoli that's got high in vitamin C, high in antioxidants, which has been shown to protect your mucous membranes. We also want to support our immune system by getting plenty of sleep and rest. And managing our stress levels. So if we get overly stressed, whether it be about this or all the things we have to do in our life, we're going to secrete more stress hormone called cortisol, which suppresses our immune function. So by getting a good night's sleep, keeping your stress levels in check, that'll help your immune system out, help keep it strong, and keep your cortisol levels in a healthy range. There's some supplements that you can take that have been studies have shown that are antiviral. Now, I'm only going to give you things that have been shown to be effective for viruses. So one would be astragalus. Astragalus, echinacea, golden seal, and Oregon grape, and elderberry have all been shown to be antiviral. Elderberry, there's been some concern in the news whether it increases cytokines to the point of cytokine storm. It's a modulator, so it does slightly boost cytokines, but it also dampens it as well, and it's never been shown to increase cytokines to the point of cytokine storm. So astragalus, elderberry syrup, I would go a teaspoon a day. Oregon grape and berberis, those two also have antibacterial properties, which is good when we talk about influenza and coronavirus. We can get secondary bacterial infections in the lungs that cause pneumonia, and that would help protect against that as well. And then echinacea. Getting enough vitamin D each day. Typically for most adults, I'd say 2,000 to 5,000, depending on their existing status of vitamin D, their existing levels. Vitamin C, broccoli's high in vitamin C, and as well as a possible supplement, about 1,000 milligrams a day. Zinc, 10 to 15 milligrams a day would be all you need. And then a formula of immune supporting mushrooms a couple times a week. And then green tea extract. Green tea extract, high in antioxidants, which have been, again, shown to protect the mucous membranes along with vitamin C and broccoli to protect against viral infections in general in the respiratory tract. I would say with this as well, protect yourself, but also let's look out for each other. So we want to self-isolate to protect not only yourself, but to protect our neighbors and our loved ones who might be at a greater risk. For those seniors who you might know who are staying home and staying indoors, keep an eye on them. Ask if they need anything. You can go to the grocery store to save them from having to go out and expose themselves to the infection. So we want to take care of ourselves, but we also want to keep track of those around us. Again, don't panic and listen to your public health officials and the CDC and what they are recommending to help prevent the spread of the virus and keep people safe. So stay healthy. I hope you found this helpful. Stay tuned. I will post more information as it becomes available, especially things that I find are going to be helpful and that might not be getting out in other channels. I'm again Dr. Lou Walters at the Source Wellness Center in Bozeman, Montana.